I think the word of the day is humility, and I am truly humbled to join you, the Hilton Foundation, your incredible honoree, and all you wonderful people here today. As our presidential campaign here in the US swings into its final weeks, we're continuously reminded of just how dark the mood is out there. It's a moment when huge swaths of the public distrust the very leaders and institutions charged with safeguarding all we hold dear, not only here in the US, but throughout the world. But it's a moment, and I use that word moment, when we gather here, not in shadow, but in light. Our great gift right here, right now, is to celebrate the leadership of an institution and that institution and all its partners who stand for all we know in our hearts to be true and enduring about humanity at its best. The story of how we got to this moment goes back nearly 200 years. In 1796, British physician and scientist Edward Jenner first inoculated a young boy with cowpox, thus successfully testing the world's first vaccine, the vaccine that would ultimately be the tool that conquered smallpox. But as anyone who's worked to bring about change at scale knows, and change at scale is what was called for in the case of smallpox, which was estimated to infect 60% of the world's population. Discovery of a vaccine, as with any technological breakthrough then as now, was only the first step. So while eradicating smallpox from the planet had long been a priority, it was not until 1959, more than 150 years later, that governments gathered at that World Health Assembly to formally ratify the goal. To meet their ambitious target, you heard, just as Dr. Kim said, they called for collaboration among governments and legions of the partners they knew would be necessary to take on this goal and the strategy that would lead to achieving it. Dr. Bill Foege, the first pioneering leader we honor here, found himself on the front lines of this war, working in Africa as a consultant to the Center for Disease Control. Realizing the scope of the challenge to vaccinate 100% of the world's population was simply too vast, he wondered if the disease could be stopped by vaccinating only those who had been exposed to those already infected. The son of a Lutheran minister, Dr. Foege tapped the network of local ministers he knew to be working in eastern Nigeria and had them canvass every village and identify active cases of smallpox. He then put his team of public health workers to work, vaccinating only those villagers who'd been exposed. The strategy, which came to be known as surveillance and containment, or circle vaccination, worked. Forget what you've ever thought about social entrepreneurship. This is what it is. It is change at scale. It is discovering the levers to drive change at scale, and it is pulling those levers, often with resources that other people have not seen. The method worked. Smallpox began to recede and ultimately disappear. The innovative approach was employed across Africa and eventually in one of the great strongholds of the disease in India. In 1980, the WHO officially declared smallpox to be the first consequential human disease eradicated from the planet. This wonderful victory was the shot in the arm the WHO needed to set an even more ambitious target, and you've heard about that too this afternoon, to immunize the world's children against diseases for which vaccines existed. But your bureaucracies, as most of us know, aren't especially nimble or swift, and so the effort languished. Once again, it was Dr. Foege who helped convene the players, UN agency heads, philanthropic leaders, the bank, others, to see what might be done to accelerate the pace and success of the endeavor. And from that storied gathering, the one Dr. Kim just described, came the Task Force for Child Survival. Its charter was clear: to facilitate not to coordinate, but to facilitate increased rates of vaccination. And you've heard about the stupendous success over 6 years. The rates went from 20% to 80%. This remarkable milestone was announced at the 1990 Summit for Children at the UN and justly heralded as the greatest peacetime endeavor the world had ever seen. The second leader we celebrate this afternoon is Dr. Mark Rosenberg. Mark took the helm of what had now become the Task Force for Global Health in 2000, charting the extraordinary trajectory of growth that continues to this day. It was Mark who brought the International Trachoma Initiative on board, and it is he who is credited with making the task force the fourth largest not-for-profit organization in the US. More importantly, because size is no measure of how good you are at your work, more importantly, over the first few years of his tenure, he codified, socialized, and put into practice the values and principles underlying the task force's work. The first of those values was compassion. In 2010, Dr. Rosenberg even gathered a remarkable public health leaders symposium on the subject of compassion, among whose attendees was President Jimmy Carter. For the task force, compassion is non-negotiable. Dr. Rosenberg and his colleagues believe that the throbbing heart of effective practice in public health is a profound sense of shared humanity. To be effective, all must see, truly see, the faces of those who are served, not as some amorphous population or anonymous sample, but as individuals, as human beings, whose lives and experience, whose suffering and whose health are etched in their faces. At the same time, Dr. Rosenberg has been steadfast in insisting on the highest and most vigorous application of scientific rigor, which has required members to invest the time and discipline necessary to get to a shared understanding of the last mile to success, what it will look like and what it will require. Little wonder that the task force's board chair, Jane Thorpe, announced Dr. Rosenberg's decision to retire with mixed emotions early this year. Ms. Thorpe's letter of announcement went on, however, to note that exceptional leadership runs deep at the task force, and that David Ross would succeed, maybe exceed too, well, how about it? Would succeed Mark Rosenberg. Dave joined the task force in 2000 as director of a program to improve immunization record systems for children. Dave is an engineer by training. Early in his career, he worked in an unlikely field, the defense industry, and yes, with the nuclear arsenal. In time, however, he decided to apply his passion for technology and information to saving lives and to the domain of public health. At the task force, he has focused on the role of information, establishing the Public Health Informatics Institute and leading worldwide efforts to improve health outcomes with accurate information. More recently, Dave has been instrumental in creating CHAMPS, the Childhood Health and Mortality Prevention Surveillance Network, spurred by the reality that 6 million children still die each year from preventable causes. CHAMPS began its groundbreaking work last year. Yes, exceptional leadership at the task force runs deep, and dare I say, it runs broad through its partnership and through all the people it empowers in all the communities it serves. And yes, leadership of the kind we all value and know to be a true expression of our shared humanity is worth celebrating. Jean Monnet, architect of the EU, liked to say that nothing changes without individuals and nothing lasts without institutions. This afternoon, we celebrate both.